Testing 1 2 3. Testing 1 2 3. Hello, my name is Robin McGrady, and welcome to my YouTube channel. Today, we're going to be talking about surviving surgical mastectomy, whether it's bilateral, unilateral, or lumpectomy. I want to talk to you about what supplies you're going to need coming home. Your hospital stay may be 1 day, 2 days, 3 days. That depends upon what part of the country you're in and whether or not you have any issues that need to be addressed that you would have a longer hospital stay. All right, please hit that click and subscribe button, and I appreciate you joining me today. Preparing for a mastectomy is probably one of the most challenging ventures that you're ever going to be in. And the first thing I want to talk about is the emotional preparation. Uh, Anytime a woman has a breast or part of her breast removed, it's very emotionally and spiritually challenging. That said, you need to have your family around you and your church family if you have it. But what I found is I was here in the Cleveland area talking to a couple of young ladies is that a lot of people are going through cancer alone. That's the Holy Spirit. And you might hear me say, Ikandala Seke, that's the Holy Spirit speaking in tongues. So if I do that, I've been trying to quell it. You cannot quell or crush the Holy Spirit. So just know what that is. But a lot of women are going through breast cancer alone. So this video is for you. If you do not have the emotional support, if the family members are gone, if nobody's answering the phone, yeah, then this is what I want you to do. I want you to set your house up. I want you to set your house up like and prepare to be alone. So what you're going to do is, number one, make sure that your alarms are working in your house. The main one is I want you to call the fire department and make sure that you have batteries in your smoke alarm and also your CO2 detector, because things come up when you that's just the way it is. When one thing goes wrong, it seems like a spiral effect. But you want to be prepared, and you want to, this is a free service. The fire department will come out whether you live in an apartment or in a home and check those alarms. That's a great service to remember. The next thing, you want to make sure that how you're going to get in and out the home, that the that's the Holy Spirit just confirming that. Yeah, make sure that if you have stairs there, well, how am I going to get up these stairs? Because the biggest part of your body that you need to be mobile is your chest and your abdomen. This is where your strength is coming from, okay? So you're going to need something to help you get around when ambulating, okay? And that's important. The next thing you're going to do is make sure that the walkway is clear and that there's no rugs or something you can trip on, because that's going to set you back. And in this video, we want you to be progressive. We want you to be successful. We don't want any setbacks. Make sure things are in reach. Make sure you have a table. If you don't have a bedside table that rolls, you can reach out to I'll put the link below. It's through one of the breast cancer centers here in Cleveland. Um, It'll come to me in just a moment. But yeah, they bring things, or they might set up where you can get things delivered. You may have to pay for that, but reach out to local community resources that may bring things to you. The next thing is you want to have Kleenex, meals, water already there, because again, your abdomen is in pain. You want to have a reacher, and you want to have your pain medications in the home or in your hand when you leave the hospital, because you're going to be in pain once the medication wears off, and you're going to need those pain medications. Also, you want to have something that your provider has for you for constipation, because the pain medications dry out your colon, dry your mouth. So something in conjunction with the pain medication We know we have to drink the water, but also some Miralax, something to prevent you from getting constipation, because that's going to cause pain even more if you're not able to eliminate your stool effectively. The next thing I want to mention is your clothing. Wear comfortable clothing, comfortable shoes, as you will not be able to bend over and tie your shoes. Something that also non-slip shoes, non-slip socks, which the hospital may provide for you. The next thing is the bra. The hospital should provide for you a bra that snaps in the front and has little hooks on it to hold your JP drains. A JP drain is a Jackson print drain that some women have, maybe some don't. Post surgery, depends on the surgery and the type of surgery you have, whether you will require it. Most people do, and you will need to know how to manage the JP drain, how to know when it's too much blood, what color the blood is, and signs and symptoms of infection. That leads me into the next video, in which I am going to talk about management of a JP drain, when to know if the site is infected by redness, purulent drainage, or just a gut feeling. I'm going to talk about that so you can know how to keep yourself safe and healthy through this process. Listen, I'm out, family. Knowledge is power. Please see me in the next video. I love you, and remember, this is where you can get emotional support. I'm praying for you. Go in prepared with knowledge and prayer. Keep your word in your mouth, because God is on your side. Be well.